Well, you mentioned kids going back to school in the fall. You mentioned COVID. I'd like to put that together. COVID continues to circulate. There are about 4,000 new cases per day in New York City, I understand. That's higher than the caseload from much of last school year. The true number is almost certainly above that because many tests aren't being reported. Are you thinking about bringing back mask mandates in schools for this coming year?
I think we have to really reassess where we are today versus where we've been. A case of COVID and its impact on human health is different today in July 2022, August 2022 versus even January 2022, certainly from March 2020. And we recognize that that's because of number one, a high wall of immunity that's been built up through vaccination. Here in New York City, we've given out more than 18 million vaccines to New Yorkers, a significant number of people infected and the transient, at least transient immunity that develops as a result of that. And of course, advances in treatment, advances in care and treatment that is enabling us to treat people early, keep them out of the hospital, and even if they are hospitalized, to prevent severe illness and death. And so, over the last several months, in the spring wave as well as this summer, we've seen a real break for the first time in the epidemic, in the pandemic, between case transmission rate and severe illness. And so we have to take that into account, and we have to decide when is the right time to, on the basis of what data, to re-implement population-wide prevention strategies. It was right and appropriate in March and April of 2020 to introduce that guidance, whether it was mask mandates or population vaccine mandates. Those were all the right things to do in a time of emergency. I don't think we're in an emergency right now. We are maybe somewhere in between emergency and endemicity. I don't know where we are in that journey. I'm encouraged by the fact that in our city and in places all across the country, cases are falling. But the fact that severe illness, the fact that hospitalizations, and the fact that the impact overall on human health and society is lessening is a good thing. And it causes us to reassess where we are in terms of the data and when to pull out those policies like mask mandates that you're describing.